Are you curious about the side effects of bisphosphonates? We have another video about what these drugs are, so I'm not going to go into a lot of detail. And before I go on and talk about those side effects and other adverse effects, I want to invite you to subscribe to our channel. We're always putting out new content, often based on questions or comments that you have and requests you have for us to produce content. There's always something new to watch. So bisphosphonates are medicines that are used in general to improve bone mineral density. They're used in people whose bones are light, either with osteopenia or more often with osteoporosis, the thinning of the bones that can increase the risk of fracture. There are a few bisphosphonates. There's abandronate, which is oral, meaning we take it by mouth. And then there's pamidronate, the brand name of which is Iridia, and zolendronate, the brand name of which is Zometa. These are the ones available in the United States. There are other bisphosphonates, but those are the most commonly used bisphosphonates. So if you've been on these medications, you know some of the side effects, but I thought I'd go through all of them. I'm going to talk about side effects and then also about adverse effects. And what the difference is adverse effects is you don't really have symptoms, but these might be laboratory abnormalities that we want to follow, that we need to be aware of and to inform you of, and make sure that if they happen, we catch them early. So the most common side effect is to have a flu-like syndrome with the first and sometimes the second infusion. We see this with the IV bisphosphonates, and it's associated with fever and aches. You really feel like you have the flu. It's quite miserable, and as long as we make sure you're not at risk for infection, you can take non-steroidal anti-inflammatory medications or acetaminophen, paracetamol in the UK. Tylenol is the brand name in the US, to manage your symptoms. And this happens very soon after you receive your infusion, so usually within a day or two. It can be as late as 4 or 5 days later. It goes away on its own, but it can be really scary because you just got a new treatment, you're not sure what's going on. Some people have it happen with the second infusion, though it tends to last for less time. And very rarely, most oncologists have seen this only once or twice, somebody will get it with every subsequent treatment. And we either pre-medicate with something to keep the fever down for the first couple days, or we switch to a different form of treatment for the bone. The other thing that's also actually more common is joint muscle aches and pains. So you might feel achy in your back, you might feel achy in your wrists, your shoulders, your elbows, your knees, your ankles, etc. And that usually happens within a week after receiving the first treatment. And it can happen for a few treatments. And actually this is more common to persist with subsequent treatments than the flu-like syndrome with the fever. So if you're having this and you're watching this video and that sounds like you, it's very likely to be from the bisphosphonate, and talking about alternatives could be really useful for you. If you're being treated for advanced disease with cancer in the bone, it can really complicate things for you and your medical team, because you will have experienced bone pain and you have cancer in the bone, and it's hard to tell what's causing the pain. This doesn't usually develop over time. It usually happens pretty early on, first treatment, second treatment, occasionally third treatment, and these treatments are given once a month or every 3 months. Somehow the body gets used to it, but it does happen early on. So if you've been on a bisphosphonate for a couple years and now you're getting achy, it's not likely to be the bisphosphonate. It's likely to be some other medication or something else going on in your body. The last group of side effects I'd like to address are gastrointestinal side effects. So nausea, very rarely vomiting, but it was seen in the clinical trials. And a lot of people with oral bisphosphonates get heartburn. So if you're on abandronate, you probably know you need to sit up for a while, take it on an empty stomach, and that's actually one of the more common reasons to switch to an IV form. The IV forms don't have the same reflux or gastrointestinal discomfort in the upper GI system, and it's pretty uncommon for the IV forms to cause GI problems, but it can happen, so we thought we would include it here. So those are the side effects: a flu-like syndrome, aches and pains, and it's often throughout the whole body, and then gastrointestinal issues. There are a couple other things that are worth mentioning. One is osteoporosis of the jaw. This is really uncommon. It's probably more common than we originally thought, but as we've gotten now decades of experience, we know that osteonecrosis, which is as bad as it sounds, necrosis refers to death and osteo is bone, and this happens in the jaw where the teeth can fall out. The way we recommend managing this is before you start on a bisphosphonate, have any dental work you need, have a dentist who is familiar with bisphosphonates take a look at your mouth. It does look like oral hygiene. Can be good oral hygiene can protect you against osteonecrosis, but it can happen even if you're not on a bisphosphonate after any dental procedure that affects the bone, like pulling of a tooth. So this is something we take very seriously, and why we don't give the bisphosphonates when there isn't a clear indication for them. And that can happen with oral as well as IV. All right, so there is one other thing I want to mention, and that is kidney abnormalities. So when somebody's on chemotherapy, when somebody's on a bisphosphonate, we regularly check their blood work. One of the things we're looking at is the kidney function. The bisphosphonate class can hurt the kidneys, and even more important, if the kidneys are already not functioning at tip-top shape, we lower the dose of the bisphosphonate, not because the body can't handle it, but because the body doesn't need that much. Because your body's not getting rid of it, your kidneys aren't as effective as clearing things from your body. We have very clearly prescribed guidelines for how to reduce the dose. So let's say you're watching this, your kidneys are a little, I'm going to use a highly technical term, they're a little twitchy, and you're wondering, can I still have a bisphosphonate? You can. The doses, we know how to reduce the doses. The pharmacist, your oncologist, they know how to reduce the doses, and we continue to watch your kidney function. So it's very uncommon and very unlikely you would have kidney damage from the bisphosphonates. Rather, kidney monitoring and dose adjustment are warranted. So are there things you should do? Well, I've already mentioned dental hygiene. Making sure you get your checkups every 6 months is probably prudent, though many people go to the dentist once a year or less frequently than that. If you're on a bisphosphonate, we really strongly encourage you to go twice a year and have a professional cleaning. We also recommend flossing and using a toothbrush twice a day, even 3 times a day. If you are really fastidious about your mouth, you're probably going to be better off than if you neglect your oral health. Oral health is important for a lot of reasons as well. Overall health and mortality is attributed to oral hygiene. So that's just an aside regarding your oral health. Stay hydrated. You can get IV fluids, or you can hydrate yourself when you're on a bisphosphonate, especially the first couple days after you get the IV infusion. Just make sure that you have lots of fluids. It doesn't always need to be water. It can be juice or fluids that we get out of food. And then the other thing is to talk with your medical team about calcium and vitamin D. A bisphosphonate helps your bones rebuild, but if they don't have the building blocks of calcium and vitamin D, it may not really be helping. I hope this is helpful. I've covered a lot of things. Drop a comment or question below. What have you experienced on a bisphosphonate? Don't forget to subscribe, and as always, thank you for watching.